Thank you, and good afternoon. So today, being Monday, we're reporting for 3 reporting periods, and I do think I have the dates right this week. Starting February 5th to 6th, Friday to Saturday, we had 428 new cases diagnosed with COVID-19 in BC. February 6th to 7th, an additional 465 new cases were diagnosed, and in the last 24 hours, 343 additional cases, bringing the total number of new cases over the weekend to 1,236, 5 of whom which were epidemiologically linked cases. And that brings our total in British Columbia to 70,952 people who've been diagnosed with COVID-19. Of the new cases, 266 were people in the Vancouver Coastal Health Region, 601 in the Fraser Health Region, 86 people were on Vancouver Island, 152 people in the Interior Health Region, and 131 people in the Northern Health Region. Today we have 3,976 active cases in all areas of British Columbia, and of whom 234 people are in hospital, 69 of whom are in critical care or ICU. And we have approximately 6,900 people under active public health monitoring, and 605 people are now recovered. Again, over this weekend, we've had 13 new deaths from COVID-19, bringing the total number of people who have died from this virus in our province to 1,259. Our condolences go out to those families and caregivers and communities who have lost loved ones again this weekend. We have 2 new healthcare outbreaks, both in acute care hospitals, one at the Abbotsford Regional Hospital and the other at Dawson Creek District Hospital. And 4 outbreaks have been declared over at Evergreen Baptist Care Centre, the Hilltop House, Mount St. Joseph Hospital, and the Nanaimo Regional General Hospital outbreaks. That leaves us with 22 active outbreaks in long-term care or assisted living and 9 in acute care, involving 786 residents and 441 staff. Since the start of our immunization program for COVID-19, 154,496 people have received a vaccine, and of those, 12,111 are people who have received 2 doses. Each week this month, our available supply will increase, and we are looking forward to early in March when we anticipate being able to fully start our mass vaccination clinics around the province, and we are planning for that and for the rollout of this phase now. For those people who are in that group that we are going to be getting to as soon as we can, people who are over age 80 in our community, in the coming days and weeks, you will receive the information you need to know where your clinic will be or how you will receive vaccine. We're working on the details in every community across the province, and they will become clear in the next little while, and there'll be multiple ways that we'll be contacting people. Just to update you on adverse events, we've had 217 reports of adverse events following immunization since the start of the program. 18 of those were anaphylaxis or severe allergic reactions, and we continue to closely monitor and track for these events, as our national and international partners do as well. And we are watching what is happening around the world so that we can be reassured of the safety of the vaccines here in British Columbia. As well, as we talked about last week, we are watching very closely for the further spread of what we call variants of concern here in British Columbia. We're now, to date, have 40 confirmed cases of the here in BC, and that's 25 confirmed cases of the B117 variant that was originally found in the UK. Of those cases, 15 are in the Fraser Health Region, 5 are in the Vancouver Coastal Health Region, 4 are here on the Island Health Region, and 1 is a person who resides in the Interior Health Region. All of all of the cases, most of the cases of this variant are related to either directly related to travel or contact with somebody who's traveled. We have one case that where we have not yet found a connection. We additionally are up to 15 people now who've been confirmed to have the B1351 variant, which was initially identified in South Africa. 13 of these 15 cases are in the Vancouver Coastal Health Region and 2 in the Fraser Health Region. And concerning for us, and we're still investigating, is how particularly 4 people from that group of 15 where we are unclear where they have contracted the virus and the variant. Of the 40 confirmed cases, though, I will say we only have 3 that are currently active, and Public Health has done extensive follow-up and tracing back of all of our cases, and the ones we know about, we are confident for the majority of them that there has been no onward transmission. Every day that we stop spread of this virus, no matter what the variant, we buy ourselves time. Time to get our immunization program up and running again, as we're going to be this week, and also time to better understand where we are seeing transmission and cases of this variant virus, these variants of concern in our communities. We are also closely monitoring our progress in this COVID-19 pandemic, and our intent is to ease the restrictions that we have in place as soon as it is safe to do so. We want to have that confidence that as we open up more, as we have more social connections, we do not have to step back again. I'm monitoring for a number of things. Fewer cases in our communities, fewer outbreaks or unchecked transmission in places around the province. These are important signs that we are ready. Also, having a better understanding of where the variants of concern are and how they're getting into our community. We are on track, and that is why it is so important for all of us to continue doing what we're doing and not throw away the progress that we have made. Our focus right now is to clear our path of those hurdles so that we can ease the restrictions as soon as possible. I will say this past weekend, WorkSafe BC and our public health environmental health teams were out again conducting spot checks and monitoring to make sure that we can support people in all places to follow COVID safety plans and keep everyone safe. And I do want to say thank you to everyone who stayed home with their families and watched the Super Bowl or went out with their close group to the restaurant sector. And I want to say thank you to that sector, to our restaurants, our food and beverage sector, and the people who were there this weekend for doing your part this weekend to help us continue to flatten our curve and support people to watch the game in a safe way. As we have seen, the choices we make today, as well as the plans we make for tomorrow, make a difference. And just as you did this past weekend, I'm asking everyone to do the same with our upcoming Family Day weekend. We all need to stay local and not travel unless it is required for work or medical reasons. I understand and know the many sacrifices that people continue to make, and I know that limiting travel impacts our tourism sector across the province. So I'm calling on everyone to support our local tourism sector. Be a tourist in your hometown, in your community this weekend. Book a night at your local hotel with your family. Order dinner from a favorite restaurant. Do takeaway. Or go outside and explore. Being outside with those that we are close to, with those we care for, is safer than being inside. So this weekend, connect and go for a walk with somebody that you're close with. Or go sit outside and have a talk. By avoiding travel now, we'll have much more to enjoy and many more places to visit in the weeks ahead once we get this pandemic under control. So let's continue to push our curve down by staying small, staying local, and using all of the things that we know protect us, no matter what the variant we're dealing with. And that means cleaning our hands regularly, staying home when we're ill, making sure that we get tested if we have any concerns about having the virus, making sure we keep our safe distances, whether outside or inside, and of course, wearing masks when we're in those common public areas. These efforts will make sure that once we have the protections we need, we'll be able to see our friends again. We'll be able to hug our grandparents and enjoy all that is spectacular in our province. We have the confidence knowing that it won't put our friends and family and loved ones at risk. We know that this virus transmits to those we are closest to. So let's do our part now to keep us all safe so that we can start to ease these restrictions as soon as possible. And of course, let's always remember to be kind, to be calm, and to be safe. Thank you.